everybody. I'm Dr. Vineet here. I'm Associate Director of Cardiology at the JP Hospital, which is in Sector 128 at Noida. It's indeed a pleasure to be with all of you today, and I shall be talking about some of the latest updates on hypertension. As we all know that hypertension is a worldwide problem. As per the WHO, nearly 63% of total deaths in India are due to the non-communicable diseases. There was a time when communicable diseases were the most common cause for mortality in the developing countries, including India. But now it is found that 63% of the deaths are due to non-communicable diseases. Of these, about 27% are attributed to cardiovascular disorders, which affects about 45% of the people in the 40 to 69 years of age group. Raised blood pressure, which is known as hypertension, is among the most important risk factors for cardiovascular disorders. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through the primary care, as well as the poor follow-up which is there. In the next few minutes, we shall talk about some of the major, the studies which have come out, some of the major data which is, available, and what are the latest updates on hypertension. Firstly, we shall talk about an article which was published in the Lancet in 2021. This data, pertains to the Indian population. And they have found that in India, the prevalence of hypertension has gone up over the past 3 decades to about 38% in men and about 32% in women, from 29% and 28% respectively about 3 decades ago. So there has been a jump in the incidence of hypertension. Despite that, nearly half of the population of men and about 40% of the population in women with hypertension are totally unaware that they suffer from hypertension. Additionally, over 62% of men and about 53% of women living in hypertension do not get any treatment at all. So neither do they know that they are hypertensive. In people who know that they are hypertensive, they do not take the treatment. Actually, we will be surprised that even in the developed countries, the situation is somewhat similar. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. So this is an alarming data which has been made available by the World Health Organization and published in Lancet. So it should be our endeavor to treat hypertension to our fullest extent, apart from diagnosing it at a proper given time. The second update is from the International Society of Hypertension, which released the ISH 2020 Global Hypertension Practical Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that is in poor resource settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource settings. The next update comes in the Journal of Hypertension in 2021. The AHA and the ACC released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low atherosclerotic cardiovascular disease risk. They said that among the low risk patients where the 10-year risk is below 10% with stage 1 hypertension, where the blood pressure would be between 130 and 139 systolic and 80 to 89 diastolic, management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy. So we all know that the lifestyle modification, weight loss, having a DASH diet, cessation of smoking, alcohol in moderation, and regular exercise and weight loss also go a long way in control of hypertension, especially in the initial stages. And also people who have full-blown hypertension should also take care of these particular risk factors. Another important data pertaining to the recent the COVID-19 induced ARDS was published in the JACC in 2021, and it was found that the ARDS, which is a potentially fatal condition in causing lung damage, and the experts often have associated it with COVID-19, as we all know. A recent study which appeared in the JACC reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. The next study comes from a Chinese journal in which the lowering of the systolic blood pressure targets has been brought down to the range of 110 to 130 millimeters of mercury and is found to substantially reduce cardiovascular events in the STEP randomized trial, affirming the findings of the SPIRIT trial for the older population, which was basically Chinese. Among some 8,500 patients aged 60 to 80 years in China, the intensive target trimmed 26% of composite cardiovascular risk. Findings from now a second major trial supporting the lower target could unite the guidelines which even among the US professional societies ranges from a threshold of 130 to 150. So the targets are going lower than what they were. Similarly, some data also coming in favor of the ambulatory blood pressure monitoring. We all know that with regards to prognostic value of ambulatory BP pressure monitoring and nighttime BP, the 2018 European guidelines on the management of arterial hypertension recommended that the diagnosis of hypertension should not only be made on the office blood pressure readings, but we should also take out of office measurements using a ambulatory blood pressure monitor or a home blood pressure monitoring apparatus. And nighttime blood pressure measurements were associated with greater risks of mortality and a composite cardiovascular outcome. Thus, they may be considered as the most relevant measurements for estimating cardiovascular risk. For every 20 to 10 millimeter increment of blood pressure at night, the risk of mortality increased by 23% and the risk of cardiovascular events by as much as 36%. Now, coming to one area where a controversy has erupted, regarding the use of valsartan. Since early July 2018, products containing valsartan have been recalled worldwide. There was especially concern regarding some batches of valsartan which were produced in China, where the highest level of contamination was found. It was found that the valsartan was contaminated by a known carcinogen, which is N-nitrosodimethylalanine, which is also known as NDMA, which is found in, apart from valsartan, also in candesartan, irbesartan, losartan, olmesartan, apart from valsartan, as we have already spoken about. The NDMA has now been classified by WHO, for research on cancer, and it has been found that for 1 lakh patients who have received NDMA contaminated valsartan from this particular manufacturing facilities every day for 6 years in the highest doses, it could result in 22 additional liver cancers over a lifetime of these patients. The presence of NDMA in these drugs could lead up to 8 additional cancer cases in 1 lakh persons if they had taken the highest dose over a period of 4 years. So definitely a matter of concern, which is there. Now, coming lastly to some updates regarding the combination therapy. Most patients with hypertension require lifetime medical therapy to acquire optimal blood pressure control. The 2018 European guidelines equally recommended 5 classes of antihypertensive drugs, considering high non-adherence, particularly highlighted to improve adherence to therapy and blood pressure control is very important. Therefore, the 2018 European guidelines recommend, especially in the context of lowering blood pressure targets, to start drug therapy with an initial dual fixed dose combination of an ACE inhibitor or an ARB with a calcium channel blocker or a diuretic. So friends, these were some of the the recent updates as regards to hypertension. Thank you for a patient listening, and we shall be in touch. Thank you so much. Bye-bye.